Hello, I'm Dr. Wanda Torres, MD. I am the founder of Suncoast Women's Care, a medical facility renowned for our expertise in women's reproductive health, obstetrics, minimally invasive surgery, and robotic-assisted surgery. Join me each week as I interview guests in the top of their fields about the world of OBGYN, exploring the innovations and personal stories that shape our medical experiences. Hello, welcome again to our podcast conversations with our providers from Suncoast Women's Care. Today we have Robin Rees, our certified nurse midwife, and we're going to be talking about the prenatal care by trimester. So we're going to start with the first trimester. So welcome, Robin, and thank you.
Absolutely. Good to be here.
So let's talk about prenatal care and what it entails. What do we want to do with our patients during the first trimester?
Okay. The first thing is when you get a positive pregnancy test at home, give the office a call. I know you want to come in right away, but typically we'll see you around 8 weeks. If you have complications in prior pregnancies or a history of any bleeding disorders or any medications that need to be adjusted, just let the girls know at the front desk and they'll get you in one of our 3 offices pretty quickly.
Okay. So, I always like definitions. So let's talk. What is the first trimester of pregnancy? When does it start? Where does it end? And what do we have to be looking forward during this trimester?
Okay. So the first trimester of pregnancy is your first 13 weeks of pregnancy, and we date it from your last menstrual cycle. So when you come in, we'll review your menstrual history and we'll give you a rough due date. Every once in a while, we'll get a due date that will change when we get your first ultrasound around 10 weeks.
So, of course, the prenatal care, what we are trying to accomplish ultimately is to have a healthy mom and a healthy baby. As you mentioned, we're going to review the whole history of the patient. Of course, if they have had history of ectopic pregnancies, miscarriages, any issues that happen during the first trimester. So I just want to talk a little bit about counseling about bleeding during the first trimester.
Right. So sometimes people have implantational bleeding. It could be like 5 weeks after your menstrual cycle. As long as it's not with a heavy bleed or with big cramping, then typically we'll just tell you to, take it easy, and then we'd come in and see you on a regular appointment. However, if you would have like lower abdominal pain, excessive bleeding, excessive nausea, or any other risks, we would see you sooner. When you come in for visits, we will do some serial blood work and get an ultrasound scheduled. If it's after hours, you could always call one of the providers on call, and a lot of times we would send you to the emergency room because until we have an ultrasound knowing where the pregnancy is located, it's considered an emergent issue.
Okay. So, of course, we talked about bleeding during the first trimester. So, what are the normal symptoms? What am I looking for that might flag me or alert me? I might be pregnant. So, what are we looking for?
First one is obviously missing your menstrual cycle. Another one could be chronic fatigue. You'll feel like you could barely get through the day. Mm-hmm. And I always say your body's in overdrive. You're working just so hard to take care of yourself and a growing baby. Sometimes you might feel some palpitations because of the increased blood volume. You might find yourself urinating more frequently because the kidneys are on overdrive as the blood volume increases. Nausea, pretty common one. The gastrointestinal system slows down. A lot of times we'll give you recommendations to do medications that are over-the-counter, vitamin B6, 25 milligrams a couple times a day. If that doesn't work, we can suggest other medications for you. Constipation is a big issue. Also, definitely get your water intake, lots of fiber, and move. Exercise is important. Mm-hmm. Other things are headaches. Sometimes you might have been someone who had multiple Cokes a day or multiple cups of coffee, and all of a sudden you decide, I'm going to stop that. Mm-hmm. You can have up to 200 milligrams of caffeine a day. You could develop headaches, so we could tailor a plan for either Tylenol or magnesium for you to help with that. Food aversions, food cravings. Yes, you might send that person out in the middle of the night because you're craving French fries or You decide you're going to make dinner, and all of a sudden, chicken, you can't even look at it. And that's very common. Usually it will pass after the first trimester.
And sometimes, our patients also mention that I'm having breast tenderness, or they want to know when they might feel the flutters of the fetus. So let us know a little bit about that, Robin.
Okay, so with breast tenderness, the breasts continue to grow until about 20 weeks of pregnancy. I recommend a good support bra. Sometimes they're off limits to your partner because they're very tender. Other issues could be like acid reflux and heartburn. You can take Tums or Pepcid if you need that. As far as feeling the baby's movement, usually it's not until the second trimester, like 16 to 20 weeks. Every once in a while, you might have a second-time mom who feels a little bit sooner.
Right.
It has nothing to do with how big you are or how small you are. It's just we have to wait for the development of the baby.
So another question that our patients ask us, and we need to counsel them about nutrition and how much weight they should be gaining during the pregnancy per trimester, and we will address that. But please comment on that, Robin.
So weight gain is necessary in pregnancy. If you start out with a perfect BMI, 25 to 35 pounds of weight gain is normal. If you start out overweight, don't be upset when we try to tell you to watch your weight. With the 15 to 20 pounds, we can send you to a nutritionist. Ideally, 3 to 5 pounds in the first trimester. After that, about half a pound to a pound a week. If you're having multiples, then we'll tailor it because they're, of course, going to require more calories, more vitamins. We'll tell you, your diet for you.
But definitely pregnancy is not a time for a strict diet or to lose weight. We expect some weight gain, and as Robin mentioned, is tailored according to your BMI. So what types of foods should I be getting during my first trimester and during the pregnancy?
Okay.
Or what should I avoid?
Right. Definitely in a balanced diet. You want to try to make sure you're getting plenty of fruits and vegetables. The green leafy vegetables are important because they have the potassium, vitamin C. Your eggs are a good source of choline that can help with brain development and preventing neurotube defects. No raw fish, but you certainly can have some fish. We try to avoid anything high in mercury, kingfish, tilefish, shark. Try to avoid unpasteurized cheeses, so eliminating brie, feta, blue cheese. Caffeine, again, limiting it to about 200 milligrams. Other foods that we really would like you to try to put in your diet are things high in fiber, something simple as chia seeds, a couple tablespoons a day to help with issues that are very common in pregnancy, constipation, and not feeling full. Keep in mind that in the first trimester, we're just trying to get by. So sometimes it might be carbohydrates and very minimal protein. If we need to supplement it, we can recommend some protein shakes and different things like that.
That's important. So you mentioned the fish that are high in mercury content, and some of them are the shark, the tuna, the mackerel, all the ones that you mentioned, of course. That kind of segues because you mentioned preventing spinal defects. So how do I, as a patient, choose my prenatal vitamin? What do I need to look for? And what I need to be careful to with those prenatal vitamins?
So not all prenatal vitamins, are the same. Trying to avoid a lot of the gummy prenatal vitamins because most of them don't have the proper nutrients that you need for you and baby. Folic acid, 400 to 800 micrograms is important. 27 milligrams of iron, and the methylated folate can help with some depression and some anemia issues. Choline is huge. 50% of women lack choline in their diet, so they recommend getting a prenatal supplement with choline. Vitamin D, 600 to 800 of vitamin D to help protect your bones and baby's developing bones, and plenty of calcium, at least 1,200 milligrams. Another important thing is getting the DHA or the EPA fatty acids, about 300 micrograms of that.
And the folic acid and the DHA are so important because they help with the neurological development of the baby, of course. And It has been proven time and time again that the folic acid does prevent spinal defects in the baby. And if you have had a history of spinal defects in a previous pregnancy, we're going to request and recommend, highly recommend, to increase the dosage of the folic acid for the current pregnancy.
They recommend 10 times the amount of
Correct.
folic acid at that point. And also for anyone who's on any kind of medicine that can break down folic acid. If you had an old-fashioned reproductive endocrinologist who still uses Clomid to help get you pregnant, that can break down folic acid. A lot of the seizure drugs can break down folic acid. Methotrexate if you have like rheumatoid arthritis.
Okay. So what exercises do you recommend during the pregnancy in the first trimester? And then we'll talk about the second trimester and third trimester.
Staying active, walking, swimming, yoga. I always say stationary activities like a stationary bicycle, elliptical. Try to avoid any high injury exercises like skiing, kickboxing, rollerblading.
Horseback riding. We're not going to do that.
Yes, I did have a patient once who fell off her horse and got kicked by her horse and ended up with emergency surgery during pregnancy and went back right on the horse the next trimester.
Okay. So any other recommendations that you would have for our patients for the first trimester?
No smoking. Try to limit the secondary smoke that you're going to be around. No alcohol use. Avoiding hot tubs, saunas. Lots of sunscreen. You will burn so much quicker in pregnancy. Make sure you wear like a wide-brimmed hat when you're outside because you can get something called melasma, which is like a discoloration to your skin from the extra hormones. Getting your flu shot, your COVID booster. Going to the dentist to decrease your risk for periodontal disease, going at least every 6 months.
And I'm glad you brought about the dental hygiene and dental health during the pregnancy, prior and during the pregnancy, and visiting the dentist, because if you have gingivitis and periodontal disease, there has been a link with preterm labor. So the patients need to definitely address this during the pregnancy and try to prevent preterm labor later on during the second trimester.
And the last takeaway is like if you have cats at home, toxoplasmosis is, a big risk factor. So you make sure you're wearing gloves and a mask, or give that chore to someone else to do. Even if you're outside gardening, you want to be careful if there's neighborhood cats with that.
Okay. So I want to thank you again, Robin, for giving us this informational talk and conversation about the first trimester during pregnancy.
Absolutely.